Welcome to Factverse. Today we're diving into some mind-blowing facts about diabetes, also known as sugar disease. Let's get started. Diabetes is a major global health concern, and its impact is something we all need to understand more deeply. It's not just a simple case of consuming too much sugar. It's a complex condition with serious implications that affect millions of people around the world in ways many don't even realize. It's a silent epidemic in many ways, creeping up and causing damage before it's even diagnosed. Here on Factverse, we believe in empowering you with knowledge, and that's exactly what we aim to do today. Understanding the nuances of diabetes is the first critical step towards prevention, better management for those diagnosed, and providing informed support to friends and family. There are so many misconceptions and overlooked details when it comes to this disease, and we're here to clear some of those up with some hard-hitting information. We want to move beyond the headlines and delve into what this condition truly means for individuals and for public health. We've compiled 10 facts about diabetes that are genuinely shocking and not widely known. These aren't just random statistics, they're crucial pieces of information that paint a fuller picture of what diabetes entails, from its global prevalence to its surprising effects on the body. I think it's incredibly important to be well informed, as this knowledge can lead to better health outcomes for everyone. So get ready to learn, because what you're about to hear might just change your perspective. Let's get into it. Kicking things off with a truly staggering statistic, India is often referred to as the diabetes capital of the world. We're talking about over 100 million people in India currently living with diabetes. To put that into perspective, that single number is greater than the entire population of many countries like Germany or the United Kingdom. This isn't just a statistic, it's a public health crisis of enormous proportions, placing an immense burden on individuals, families, and the nation's healthcare system. The sheer scale is hard to comprehend, and it underscores how widespread this condition has become in certain parts of an increasingly globalized world. Now, why India? Well, the reasons are complex and multifaceted, involving a combination of genetic predispositions, rapid urbanization, significant lifestyle changes, dietary shifts towards more processed foods, and increasing rates of physical inactivity. It's a perfect storm of factors. This situation highlights the urgent need for widespread awareness campaigns, accessible screening programs, and effective management strategies tailored to the Indian population. Understanding this global hotspot helps us appreciate the varying impact of diabetes worldwide and the specific challenges different regions face in combating this growing epidemic. It's a stark reminder that diabetes is not a one-size-fits-all issue. This is a point that causes a lot of confusion, so let's clear it up. Type 1 and Type 2 diabetes are fundamentally different conditions, even though they both fall under the umbrella term diabetes because they both involve problems with insulin and high blood sugar. In Type 1 diabetes, the body's own immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Think of it as an autoimmune condition. This means the body produces very little or no insulin, so individuals with type 1 absolutely require insulin therapy, usually through injections or an insulin pump, just to survive. It often, though not always, develops in childhood or adolescence. Type 2 diabetes, on the other hand, is far more common, accounting for about 90 to 95% of all diabetes cases. In this scenario, the body either doesn't produce enough insulin or, more commonly, the body's cells become resistant to the insulin that is produced, a state known as insulin resistance. It's like the key, insulin, is there, but the lock, the cell receptor, isn't working properly. This type is strongly linked to lifestyle factors like obesity, poor diet, and lack of physical activity, and it typically develops in adulthood, although we're alarmingly seeing it more in younger people now. Understanding this distinction is critical because the causes, risk factors, and often the primary management approaches are very different for each type. When people think about foods that contribute to diabetes risk, sugar-laden items like candy, soda, and desserts are usually the first things that come to mind. And while it's true that excessive intake of added sugars is a major concern, it's absolutely crucial to understand that it's not only about sugary sweets. Other foods, particularly those high in refined or simple carbohydrates, can have a very similar and sometimes even more dramatic impact on your blood sugar levels. I'm talking about things like white rice, white bread, pasta made from refined flour, and many processed breakfast cereals. These foods might not taste overtly sweet, but they are broken down very quickly by your digestive system into glucose, which then enters your bloodstream. This rapid conversion leads to a sharp spike in blood sugar, prompting your pancreas to release a surge of insulin to try and manage it. Over time, frequent and large blood sugar spikes and the subsequent high insulin demands can contribute to insulin resistance and eventually lead to type 2 diabetes. So it's not just about avoiding the obvious sugars, it's about being mindful of the type and quantity of all carbohydrates you consume, prioritizing whole grains and complex carbs that digest more slowly. One of the most insidious and dangerous aspects of type 2 diabetes is that it can develop very gradually, often over many years, without causing any noticeable symptoms in its early stages. This means you could have elevated blood sugar levels, technically pre-diabetes, or even full-blown diabetes, and be completely unaware that anything is wrong. People can walk around for years with this condition, silently progressing, feeling perfectly fine, or perhaps attributing mild symptoms like slight fatigue or increased thirst to just getting older or being stressed. This asymptomatic period is a huge problem. The lack of early warning signs means that by the time symptoms do become pronounced enough for someone to seek medical attention, significant damage to various organs and systems in the body may have already occurred. We're talking about potential damage to the eyes, kidneys, nerves, and cardiovascular system. This is why regular health checkups and screening, especially if you have risk factors like a family history of diabetes, are overweight, or lead a sedentary lifestyle, are so incredibly important. Catching it early, or even in the pre-diabetes stage, can make a world of difference in preventing or delaying serious complications. Don't wait for symptoms to appear. Now for some potentially very good news, especially concerning type 2 diabetes. For some individuals, particularly those who are newly diagnosed or in the earlier stages of the condition, it's actually possible to manage and in some cases even achieve remission or reverse type 2 diabetes through intensive lifestyle modifications. And a cornerstone of this approach is regular physical exercise. When I say exercise, I don't necessarily mean you have to become a marathon runner overnight. Consistent, moderate activity like daily brisk walking can have a profound impact. Losing even a modest amount of weight, if you're overweight, can significantly improve insulin sensitivity, meaning your body cells become better at using insulin to absorb glucose from the blood. Exercise itself helps lower blood sugar levels and improves how your body uses insulin. When combined with a carefully planned, healthy diet, focusing on whole foods, portion control, and reducing processed items, the results can be remarkable. Some people have been able to reduce or even eliminate their need for diabetes medications. This isn't a guaranteed outcome for everyone, of course, but it highlights the incredible power of lifestyle choices in managing and sometimes overcoming type 2 diabetes. It's a common misconception to think that diabetes is solely a sugar problem, something that just affects your blood glucose levels, and that's the end of it. But the reality is far more complex and serious. Persistently high blood sugar levels over time can act like a slow poison, damaging blood vessels and nerves throughout your entire body. This means diabetes isn't just about managing sugar, it's about preventing widespread systemic complications that can significantly impact your quality of life and even your lifespan. It's a whole body disease. Let's talk specifics. Diabetes is a leading cause of blindness in adults due to a condition called diabetic retinopathy, where blood vessels in the eyes are damaged. It's also a major contributor to kidney failure, requiring dialysis or a transplant through diabetic nephropathy. Nerve damage or diabetic neuropathy can lead to pain, numbness and tingling, especially in the feet, which can also result in serious foot ulcers and, in severe cases, amputations. And perhaps most critically, diabetes significantly increases the risk of heart disease and stroke, which are the leading causes of death in people with diabetes. This is why comprehensive diabetes care involves monitoring and protecting all these organ systems. Chapter 7. Prediabetes, your crucial warning signal. Before a person develops full-blown type 2 diabetes, there's often an intermediate stage known as prediabetes. Think of this as a critical warning sign. A yellow light telling you to slow down and make changes before you hit a red light. In prediabetes, your blood sugar levels are higher than normal, but not yet high enough to be officially diagnosed as type 2 diabetes. Millions of people have prediabetes, and many of them don't even know it, which is concerning because it significantly increases their risk of progressing to type 2 diabetes, as well as developing heart disease and stroke. The good news about prediabetes is that it's often reversible. This is your window of opportunity. If you're diagnosed with prediabetes, it's not a life sentence of inevitable diabetes. By implementing proactive lifestyle changes, such as adopting a healthier diet, increasing physical activity, and losing a modest amount of weight if needed, many people can successfully lower their blood sugar levels back into the normal range and prevent or significantly delay the onset of type 2 diabetes. It's a wake-up call to take action, and acting fast can genuinely change your future health trajectory. Don't ignore this crucial warning. To truly appreciate the medical advancements we have today, it's important to look back at history. Before the discovery of insulin in 1921 by a team of Canadian scientists, Banting, Best, MacLeod and Collip, a diagnosis of type 1 diabetes was essentially a death sentence. Children and young adults diagnosed with what was then often called juvenile diabetes would waste away and typically survive only a few months or at best a couple of years, often on starvation diets that merely prolonged the inevitable. It was a devastating and hopeless situation for patients and their families. The isolation and purification of insulin and its subsequent availability for therapeutic use was one of the most monumental breakthroughs in medical history. It transformed type 1 diabetes from a fatal disease into a manageable chronic condition. Suddenly, people who were on the brink of death could be brought back to life, their energy restored and their futures given back to them. While insulin is not a cure for diabetes, it is a life-sustaining treatment for everyone with type 1 diabetes, and for many with advanced type 2 diabetes. Millions upon millions of lives have been saved and dramatically improved because of this incredible discovery. Diabetes can also manifest in a specific way related to pregnancy, and this is known as gestational diabetes. This type of diabetes develops during pregnancy in women who did not previously have diabetes. It occurs because the hormonal changes during pregnancy can make the body's cells more resistant to insulin. The placenta produces hormones that sustain the pregnancy, but these hormones can also block the action of the mother's insulin in her body, leading to insulin resistance. If the pancreas can't produce enough extra insulin to overcome this resistance, blood sugar levels rise, resulting in gestational diabetes. While gestational diabetes typically resolves after the baby is born, it's not something to be taken lightly. It can pose risks to both the mother and the baby during pregnancy and delivery, such as a larger baby size, which can complicate birth. Importantly, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. Similarly, babies born to mothers with gestational diabetes also have a higher risk of developing obesity and type 2 diabetes as they grow older. So it serves as an important indicator for future health monitoring and preventative measures for both mother and child. There's a persistent myth that if you have diabetes, you can absolutely never eat sweets or any sugary foods ever again. This idea of a total ban can be quite daunting, and frankly, it's not entirely accurate. While it's true that people with diabetes need to be very careful about their sugar and carbohydrate intake to manage their blood glucose levels effectively, it doesn't necessarily mean a lifetime of complete deprivation from all enjoyable foods, including occasional treats. The key words here are balance, planning, and portion control. A healthy eating plan for someone with diabetes is generally similar to a healthy eating plan for anyone. Rich in nutrients, low in unhealthy fats and processed sugars, and balanced with whole grains, lean proteins, fruits and vegetables. If a person with diabetes wants to include a small portion of a sweet treat, it needs to be carefully factored into their overall meal plan, considering its carbohydrate content and potential impact on blood sugar. Working with a doctor, dietitian, or a certified diabetes educator is crucial to learn how to make these choices safely, perhaps by substituting it for other carbohydrates in a meal, and monitoring blood sugar levels closely. It's about smart management, not total elimination. So there you have it, 10 shocking facts about diabetes that I hope have given you a deeper and more nuanced understanding of this complex condition. From its surprising global hotspots like India, to the fundamental differences between type 1 and type 2, and the often silent progression of the disease, there's so much more to diabetes than many people realize. Knowing that rice and white bread can be culprits, or that exercise can potentially reverse type 2, empowers us to make more informed choices. The journey of discovery with insulin, the specific challenges of gestational diabetes, and the reality that diabetes affects the entire body, eyes, kidneys, nerves, heart, all underscore the seriousness of this condition. But equally important is the message of hope and control. Pre-diabetes is a warning we can act on. And even with a diabetes diagnosis, careful management, which can include enjoying sweets responsibly, allows for a fulfilling life. My goal today was to arm you with this knowledge because understanding is the first step to action. Thanks for watching Factverse. If you found these facts about diabetes surprising, make sure to like, share and subscribe for more amazing content. Stay healthy and informed. Your health is your most valuable asset, and the more you know, the better equipped you are to protect it. We'll continue to bring you information that matters, so hit that notification bell so you don't miss out. Until next time, take care.